Are you ready to abandon conventional dentures and improve your quality of life? After wearing a denture for several years, the jawbone deteriorates due to constant pressure. The changes in bone make the dentures fit poorly. Overdentures are dentures retained by dental implants, providing improved support, allowing your chewing to be more natural. The secure fit eliminates the rubbing, thus eliminating sore spots. Schedule a consultation and discuss your treatment options, and begin to enjoy keeping your teeth in place.
Welcome back. Well, today we have on Dr. Gate Sahafi, and she is the owner of Dover Dental. Nice to have you here today. Good to see you again. And we're going to talk about something that are called overdentures, or a procedure. And I know we got a couple slides we're going to be showing here, but basically, what are they? I mean, when I look at here, we're going to talk about somewhat about implants here, but what are overdentures versus regular dentures versus just implants?
Okay. Overdentures are basically dentures that are retained by implants.
Okay.
So when you don't have implants, your denture is resting on your tissue and your bone.
Yeah.
When we place 2 to 4 implants, your dentures, instead of sitting on the tissue, they're sitting on the implants. They're retained by implants.
Okay.
So we are talking about better fit, more retention, and less rocking.
And in this case, at least by the photo I see here, it's a full mouth denture. Is that kind of what you're talking about here?
Exactly.
Okay.
Exactly. And then a lot of patients ask me, like, so if I get the implant, what's going to happen to my denture? I always tell them, you keep that denture. We'll just make your denture fit into those implants.
Oh, really? They don't have to get a whole new...
No, you don't.
Oh,
if your dentures are good and they look good and you're happy with the color and shape of your teeth, all we can do is just to work on that denture and then make it fit to your implants. It's a very simple procedure, but it's a life-changing procedure.
Now, one of the questions that I have here when I see something like this is the maintenance of the dentures. As far as at home, do people just brush as normally? Do they have to come out every once in a while so you can clean underneath? How does that process
Good
work?
question. When you have overdentures, the only thing that you need is that every 2 to 3 years, if you look at this picture, you see the implants, and there are 2 anchors that are attached to those implants. Inside the denture, there are caps. Those caps snaps on to those anchors. So there's a little plastic that is inside those caps that just wears off. And every 2 to 3 years, you need to change it. And I mean, the cost of those little blue caps, it's like $35. It's that cheap.
Wow.
So that's the only maintenance that you need.
But so people keep these in all the time then?
Yes.
It's not like they go to bed at night and need to take them out or anything like that?
Here's what I tell my patient. Before, we used to always tell our patients, remove your denture when you go to bed. But then we realized that when patients, remove their denture, they snore. What happens that when you have your teeth on, your upper and lower jaw are kind of resting like this. When you remove your denture, your jaw collapses. So your tongue doesn't have enough room, falls back, and you snore and you can't breathe well, and causes a lot of sleep apnea. So we always tell our patient, if your dentures are fitting well, just wear them while you're sleeping. And by having those overdentures, they're not moving, they
stay in.
Exactly. So just keep them when you go to bed. Just like you remove them, like once in a while, brush it, like clean it, like you brush your teeth,
Okay.
If there is like some food or plaque that is getting stuck underneath.
So the patient can remove those themselves?
They can.
Oh, they can?
They can.
There's not a special tool?
No.
Like
They have to just play with it a little bit, make it a little bit loose, and then they can take it out.
Wow.
It's amazing. I did it for my dad. My dad was always complaining about, his denture. We placed the 2 implants. We waited about 6 months. You need about 6 months for the implants to heal and then get integrated to your bone.
Okay.
Once that phase is over, we place the anchors, and then we make the denture fit to those anchors, and then they're done. That's it.
During that healing process, does the patient have to be careful about what they eat or anything like that?
No, because implants are embedded into your bone. You won't even see them. So it looks like what you used to have. You're going to see your,
There's not much discomfort then?
No, they're going to still wear their denture like they used to be. And then after 6 months, when the implants are healed, we make a small flap, we bring the implants out, we place the anchors, and then we make the denture fit. So, I mean, there's probably 2 to 3 visits until the whole procedure is completed.
What about over time? If the jaw shifts, or I don't know if they change shape or whatever, but does that happen? Like the jawline, the jawbone, can it shift or change shape over time where this has to be adjusted?
You ask excellent questions. So if you don't have implants, if you don't have any teeth, your jaw changes completely. You need teeth to stimulate your bone. When you lose all your teeth, there is nothing to stimulate the bone, so the bone starts to get resorbed. And that's why you see patients who are wearing dentures that like every 4 or 5 years, they need those dentures to be relined because it starts getting loose, it starts causing sore spots. But when you have implants, those implants stimulates the bone. And then that helps for the bone to be more stable. So honestly, I can tell you that once you have those implant placed, everything is going to be pretty stable.
Okay.
Yeah.
And we're looking at some animation here about how it pivots on there.
Exactly.
Now, the blue there,
that's the plastic top that I was talking about.
And there's a bit of cushioning in there?
Exactly.
Okay.
So it feels like natural teeth. It's not like rock solid. It moves a little bit, so it makes it much more comfortable.
Okay.
But at the same time, it's so comfortable that you can bite on a hard apple and that denture won't move.
And what are they made out of? The actual metal of the
titanium. They're made of titanium.
Okay.
And another thing I wanted to talk about is a lot of patients who have dentures, they use adhesive. They have done a lot of studies and they have found out that patients who use those adhesives, they have a high level of zinc in their blood.
Wow.
That can cause toxicity and then cause neuropathy. So they started telling patients try to use as less as much possible of adhesive.
Here we see a before and after, right? And so much so, it almost doesn't look like the same person. But this is someone who obviously doesn't look that old, but somehow lost their teeth early on.
Yes.
And how it changes the whole jawline, right?
So here the problem, when you lose your teeth, your bone starts to get resorbed. Like if you take a picture of someone's jawbone right after the extraction, and take another picture 2 to 3 years later, you see that they have lost about 2 to 3 millimeters of height.
Wow.
So that makes your face collapse and kind of sunk in. So by placing those implants and then putting those dentures on, we kind of raise the vertical height, the distance between the tip of your nose and the tip of your chin. By raising your face a little bit, you look younger, and then some of your wrinkles disappear. If I do a regular denture, I can't do that.
Right.
You cannot add that much height, otherwise the denture will rock and move a lot.
What about the procedure? How long does it take? And I guess it would depend if someone has dentures they currently like, and if they don't, if you have to do a whole new set, am I right?
Okay, what we do is that if they come in and they say, Dr. Sahafi, I don't like my denture, I want to get a new set of dentures. I said, hold on to those dentures, we'll place the implants, keep those dentures until your implants are ready.
Okay.
Once the implants are ready to be, to getting the load of the denture, at that time we start the process of the new denture.
Okay,
and
got
they
it.
still keep that denture, and then when that new denture is ready, then we make them fit to those implants. So they will keep the old implants until their implants are ready to be loaded.
All right, very good. And as far as people, it sounds like almost anyone can have this done. Are there some people, maybe because of medical conditions, can't?
Women who have used Fosamax, for example, for bone density problem,
Okay, right.
Those are high risk. So we have to do a lot of blood tests. We have to take them off of Fosamax for a couple of years. So these are, we don't recommend that. some people who are like have a poor quality bone, and but these implants are different than regular implants. These implants are very short. So
Okay.
even if you don't have enough bone heights, you're still going to be a candidate for those implants because they're not very long. Because
Okay.
all we need is just a little anchor. So short implants, I can tell you almost 95% of my patients are a good candidate. Few people are like, yeah.
Very good. All right. So if you are interested, please give the doctor a call. The number is 949-548-0966. It's doverdental.com, easy to remember. And you got dentures and you like to change those out and have a better fit and smile and jawline, she can help you. Good to see you.
Thank you very much.
All right, you take care.
Thank you. Thank you for having
All
me.
right, we'll be right back.